Welcome to today's news briefing, co-hosted by Ethnic Media Services and Vaccinate All 58 with the California Department of Public Health. I'm Sandy Close, EMS Director, and today's moderator. Today, our news briefing explores what parents and caregivers need to know about vaccinating California's youngest kids, especially those aged 6 months to 4 years, against COVID-19. The US Food and Drug Administration last week authorized emergency use of 2 COVID-19 vaccines made by Moderna and Pfizer-BioNTech for children 6 months to 4 years old. Vaccination is an important tool to protect their long-term health against COVID-19 and helps achieve full family protection against this deadly virus. The approval comes on the heels of news that COVID-19 is now the 5th leading cause of death in children 1 to 4 years old, and the 4th leading cause of death in children younger than 1. Sobering statistics for all of us. Our speakers will discuss what side effects we can expect and how long they will last when a kid gets vaccinated. Which is the most effective vaccine for your child? How long will immunization last? How many boosters will a 6-month-old or 4-year-old need? What did the clinic trials conclude? Those are only a sampling of questions I'm sure our reporters will have. Our speakers include Dr. Lucia Abascal with the California Department of Public Health, Dr. Jennifer Miller, a pediatrician with East Bay Pediatrics and a frequent guest on EMS briefings, Dr. Sarah Takakawa, an obstetrician gynecologist with Kaiser Permanente, who with her husband has 3 children between the ages of 8 months and 5 years. Our 4th speaker, her husband, Dr. Voltaire Sinagayan, unfortunately is now looking after their middle child who tested positive just late yesterday. We will send expanded bios of our speakers and a video of today's briefing to all attendees this afternoon. And we ask our speakers to speak slowly, as I'm doing, for our interpreters in Spanish, Korean, and Mandarin. We ask reporters to enter questions in the chat box, which we will take after each presenter and as time allows. So we begin. Our first speaker, welcome Dr. Lucia Abascal with the California Department of Public Health, who will give us an overview and explain when vaccines, well, I guess they became available as of Tuesday, but are available for Californians. Dr. Abascal, thank you.
Hi, good morning. Thank you, Sandy, for that introduction. I'm very happy to be with all of you. As Sandy mentioned, I am with the California Department of Public Health. I also work at UCSF as a global health researcher focusing on vaccine uptake. And well, I think I have a very similar story to Dr. Takekawa. My 19-month-old daughter just got COVID 2 weeks ago. I've been waiting for I was pregnant when the pandemic started. I've been waiting for that vaccine all this time, and she tested positive. But I guess that's how these things are. In our case, she did transmit the virus both to my husband and I am 32 weeks pregnant. So that was, I mean, I was being extra careful myself, but well, just like a heads up of the situation we're living right now. We've seen an increase in cases in California. I mean, globally, but in California, it seems to be flattening out, but we're still seeing in some spaces a lot of cases. This is due to the highly contagious Omicron subvariants that have been circulating. So there is definitely still a need for vaccinations for the whole population, but now we have a new population that has the vaccine available for them. This is very important. There's this idea that Omicron is milder, but if we look at children data in this age group, we can actually see that hospitalizations peaked the record in January, February, when the Omicron surge started for this group, as well as deaths. So definitely there is a need to vaccinate young kids. The misconception that kids are safe, that nothing happens to kids, is wrong. We have more and more evidence that kids are at an acute risk of being hospitalized for COVID. We've definitely seen some deaths. Kids can also suffer from midterm consequences, such as multi-inflammatory syndrome in children, and long COVID has also been reported in kids. So there's definitely a need to protect these young kids. We also know that even though people can get COVID vaccinated, as we've seen in adults, you can also get that in children, but protection for severe disease is there. And that's what we saw with the FDA's authorization. So just going over a little bit of what the steps for the approval were. We had an independent expert panel that went over the data that both Moderna and Pfizer submitted. They are expert in these topics. They're not government workers, so that's why it's called an independent panel. They went over the data and they all voted unanimously. They all voted to recommend that the FDA approved the vaccine. After that, we had a big FDA meeting where they went over everything. That is public data. You can go over the slides that were presented. You can go over the data. This is to create trust, to create transparency. Similarly to the independent panel, they all approved the vaccine. Why? Because the vaccine was shown to be effective. The efficacy numbers we were shown in that meeting, even though weren't as high as what we saw when the adult vaccine was approved 2 years ago. Well, no, sorry, like 1 year ago for the adults vaccine, we did see efficacy that was expected with the subvariants that are circulating now, right? So we know that the vaccine works. And another thing that was presented was the safety profile of both vaccines. And we were shown that both vaccines were safe, okay? So after the FDA approved this, then the decision jumps to the CDC, right? So the CDC then makes a public health recommendations from the federal level to states and they approved it as well. Now, going down to California. So I just wanted to show you all the steps that go into the approval of the vaccines. So then when the CDC makes the recommendation, approves the vaccine, California goes over the data and with the neighboring states, they decided that it was the best for children in California to get the vaccine. So what is going to happen with the deployment of the vaccines in the states? We knew this was happening. We weren't sure when, but California knew this was happening. So a while back, the state started working directly with pediatricians for them to get enrolled in a program to receive the doses they might need. So with this program, the state enrolled a lot of pediatricians that actually cover around 85% of the state's children. It gets a little bit tricky with younger children. Why? Because adults can get a COVID vaccine at the pharmacy, right? But federal regulations don't allow pharmacies to vaccinate children under 3. So we have in this population a small group that will be able to be vaccinated at the pharmacy, but we have the bigger group between 6 months and 3 years that will need to go either directly to their pediatrician or small community clinics that will be set up depending on the county where children live. So it will be very important that parents reach out to their care providers for this, because we don't have either the mass vaccination sites and we don't have this big access with pharmacies. The state has purchased enough vaccines for every child in California, and they will start coming in batches. So by this week, we're expected to receive around 500,000 vaccines, which will start vaccinating children. So we are expectant. We haven't seen the uptake in older kids that we would want to see. There's a lot of work to do informing parents, really getting them to understand the need that exists for this vaccine. So that's very important. And in terms of what vaccines will be offered, this will also be different to what we've seen with other older groups of children. Why? Because both Moderna and Pfizer will be available for children since the beginning. What will be different? So this can also be tricky and confusing to parents, but we have 2 vaccines, both Moderna and Pfizer. The Moderna is a 2-dose, just like adults. The first vaccination schedule is 2 doses with a month in the middle. Then we have the Pfizer. So Pfizer is actually 3 smaller doses. And that's why the Pfizer data took a little bit longer to come in. So what is the timing for those vaccines? So for Moderna, we have the first dose, then a month, and then the second dose. So we would expect children to be fully vaccinated 2 weeks after their second dose. That is compared to Pfizer, which will take a little bit longer. We'll have the first dose, then 21 days later, children can get their second dose, and then 60 days later, children can get their third dose. So this schedule of vaccination takes longer than the Moderna. So some parents might prefer to go with a faster effectiveness compared to the slower one. But why is this? Moderna uses a bit of a stronger dose. So the Moderna vaccines are 1/4 of the adult dose. The Pfizer vaccines are 1/10. So you can see how Moderna is a higher dose than the Pfizer one. Both are very safe, but a little bit of like stronger immediate side effects were seen with the Moderna. What do I mean with that? Children presented a little bit more fever and a little bit more irritability after the Moderna vaccines than the Pfizer. Just want to make clear that these were minor, treated at home, and disappeared after 2 days. So both safety profiles are very good, very positive. We did not see any like severe effects in the children. But we have to remember that most of the rare side effects we see once we've vaccinated millions of children. So we still have to wait and see, and we're definitely going to follow up on side effects that children can develop. So those are the 2 vaccines that have been approved for this age group. In California.
Could I interrupt you just quickly? A question in the chat. You said 16 or 60 days.
60.
That's
2 months.
Just want to emphasize that for interpreters. Thank you.
Yes, sorry. So just in terms of California, we're looking at 2.2 million children that will be eligible to receive this vaccine. So definitely a very, very big state with a very big group of eligible children.
Now, go ahead, please.
No, No, we can go with questions, and that way I can just answer them.
Well, a couple of questions before we go to the chat. How did your child do with COVID? How serious a case was it? And there is a question of, if your child does have COVID, how long do you need to wait before you get vaccinated, the vaccination for the child?
Yes, so my daughter actually was fine. I mean, she did have a fever for 3 days. She's a very healthy child, so that was surprising. She was tired. I think the hardest part was staying inside with her. We continued to test positive up to like 10 days. So definitely being inside, both of us, both parents were sick. We were fine also, but just like all you want to do is watch TV and rest, but you have a 1.5-year-old that just wants to do the opposite. So that for us was the toughest. I mean, also for me as I am in my 3rd trimester of my pregnancy. So also managing that closely with my doctors to see if I should take medication or not. But thankfully I was also fine, and the son I'm expecting is also fine. So we're all doing great. But I think actually my daughter was the one that had it the toughest. My husband and I did never get a fever because we're both vaccinated and boosted. So definitely a need there. In terms of waiting for the vaccine, there is no, so at the beginning of the vaccine rollout, everybody said, if you just got COVID, wait. This was more of a supply issue, right? So we know that even though natural immunity is not as good as the vaccine immunity, it exists, right? So we, at the beginning of the vaccine rollout a while back, we did not have enough vaccines to serve everybody we wanted to vaccinate. So there was this idea that people that had just recently gotten COVID could wait a little bit to get their vaccine. Now we have enough supply for everybody, so people can get vaccinated immediately after having COVID once they end their isolation period. There's no side effects, there's no issue with doing that. I'm getting my daughter vaccinated as soon as possible, and I'm not waiting.
You mentioned that the vaccines are now available. Could you tell us if it is your recommendation that if people don't have a medical provider to go to, that they could visit myturn.ca.gov? Could you give us a little information about that?
Yes, so our first recommendation for parents that have access to a pediatrician or have worked with pediatricians before is to go that route, but definitely using myturn.ca.gov also works for parents, and they can also find their kids' vaccines that way.
And another question that has been texted to me is, if the symptoms are mild in young kids, and what is the point of vaccinating them? Why expose them to possible side effects? What is your best argument on that, Dr. Abascal?
Well, first I would ask them to define mild, right? I mean, I definitely say that my child got a mild infection. She was still in bed 3 days with a fever, which is, I think, more than I would expect after the vaccine. She also transmitted the disease to me and to my husband, right? So, I mean, that's a risk I did not want to take. We have a lot of families. I am Mexican, and in our community, we have a lot of multi-generational families. So this time my daughter infected both healthy adults, but there's a lot of grandparents that also live with children, right? And that's another risk we have to consider, because vaccines serve different functions. The first one is to protect oneself, right? So even if it's not a perfect protection, there's protection against getting infected. So you do slash that out. We actually saw that with Moderna, with the vaccine in these kids, that's around 30 to 50% reduced infection. With Pfizer, their reported data is up to 80% after the third dose. So there's definitely a smaller probability of getting infected, right? So that's the first step. Then if we do get infected, which could definitely happen, we have a way, way lower probability of ending in the hospital. If we end up in the hospital, a lower probability of ending in the ICU. We end up in the ICU, a lower probability of death. So we see benefits in all of the steps of the disease, right? Then, so it protects oneself, it protects others in our household, it protects others in our community, right? My daughter got infected at daycare, right? So we have there a cluster of children, and this is happening in their households as well. I know that other parents in my daughter's classroom also got infected, right? So if we slash the probability of children getting sick, we slash the probability of these clusters happening. And then lastly, we have the global idea, right? So if more people have immunity because of vaccines, we make COVID cases less explosive. We also, so variants, we also fight against the emergence of new variants that happen because the virus is not pressured by the immune system. So we do see a lot of benefits of vaccinating, children, but everybody as well. Also, we know that even children with mild infections, even children with asymptomatic infections are at risk of developing a multi-inflammatory syndrome in children. That's a disease that can make them go to the hospital. All of their body, all of their organs get inflamed because of an exaggerating immune response. And similarly, children with mild infections can also have long COVID. We have, even if it's not great data, and we have seen very different numbers, we have seen evidence that vaccines do reduce the risk of long COVID. So definitely, even if it's a mild case, we should vaccinate. And then in terms of reinfection, we've seen that vaccines hold up way better against new variants and subvariants than natural immunity. Even though the body does create immunity after being exposed to COVID, this is very dependent on the person's immune system. But vaccines create a stronger and better immune response that can protect against different variants. And this is something we don't see as strong as with natural immunity. And a mild case can have a mild immune response. So even if your child has a mild case, vaccines will build up the better response. Actually, and Moderna did show the data comparing natural immunity and vaccination. We saw that vaccination did create a bigger immune response. And then they compared that to children that had been previously infected and gotten a vaccine. And children that had been previously infected and got the vaccine were actually the most protected group. This is not surprising. This has been reported as hybrid immunity and has been widely reported. And it's a very big case for vaccinated children that have had COVID before. And I think I'm even excited that my daughter will now get the vaccine because she'll have these super strong antibodies.
Right. Before we go to our next speaker, just two questions quickly from the chat. Myocarditis. You referenced myocarditis. Could you just say one or two sentences about the very low risk of myocarditis, which
yes.
I believe, and what the trials with the vaccines demonstrated for the youngest kids?
Yes, definitely. And I know that probably Dr. Miller, being a pediatrician, can talk more about it. But what was seen on the trials, there were no cases of myocarditis reported. This is good, but it's expected given that myocarditis shows up when we vaccinate a lot of children. What we've seen, what has emerged in population-based studies, not only in the US, but worldwide, is that myocarditis affects older children, right? So from 16 and up, and it seems to be a mixture of hormones and the vaccine. So it's really not a risk expected in this population, but we have to wait and see what the follow-up as we ramp up vaccination is.
Thank you. And then can my child receive the COVID-19 vaccine and other vaccines on the same day?
Yes, they can get vaccinated. There's no interference.
Okay, great. There are other questions. If you wouldn't mind looking at the chat, you might be able to answer some of them before we get to the final round of questions. Now we go to our second speaker, Dr. Jennifer Miller. And Dr. Miller is a pediatrician with East Bay Pediatrics. Dr. Miller, thank you for joining us. You're going to share with us some of the concerns your parents and children bring to you in your office. Thank you.
Good morning. Yes, thank you, Sandy. Thank you so much for having me back. I'm happy to be here today. What I want to start talking about first is what I'm seeing in my practice. I would say I'm seeing three major groups of patients and families. The first group are families that are beating my door down, that are anxious to get their children vaccinated. Much like Dr. Abascal, they've been waiting since the beginning of the pandemic, worried about their kids getting COVID. They're calling, they're emailing, they're asking for appointments. They're traveling next week, next month, and they're ready to get their kids vaccinated. Those are probably the easiest bunch. The second group of families that I'm seeing are families that thought they were ready. They were excited about the vaccine, they were ready, but now that the vaccine is here, they're having second thoughts. They believe in science, that they're protective of their children, but they have a healthy fear of the unknown. They have questions, and they don't feel so confident about moving forward until they have more answers. The third group of families that I'm seeing are parents that just are not going to get their kids vaccinated. They might have vaccinated themselves, but they don't feel comfortable getting their kids vaccinated. They sometimes don't agree with flu shots. They say they've never gotten the flu. Why would they get the COVID vaccine? They don't feel that the vaccine is safe. They don't feel that it's necessary. And they're afraid of the side effects, the complications from the vaccine, and they're afraid of the long-term effects of the vaccine. They will not get it until it's officially approved by the FDA, not just an emergency use authorization. They're afraid of some of the things Dr. Abascal mentioned, like myocarditis, and they're afraid of fertility issues. So let's talk a little bit more about the specifics of these concerns. What are they concerned about? I'll say they're concerned about side effects. One family yesterday told me that they heard the vaccine could kill them. So why would they get their child a vaccine that they thought could kill them? They worry that the side effects are dramatic and dangerous. But what I find is that the side effects, like Dr. Abascal mentioned, are things like a low-grade fever, pain at the injection site, and body aches. These are really common side effects that we see really with pretty much all childhood immunizations. So these are not new to families. And what I remind families is that these are a sign that your immune system is activated and it's there to protect you. Other families are concerned about fertility issues. Several of my moms have told me that the COVID vaccine affected their very previously normal menstrual cycle, like clockwork. And now that now they got the COVID vaccine, their menstrual cycle is irregular. And they're worried about this affecting the fertility of their teenage daughters. There's no data that supports this. And in fact, much like Dr. Abascal, over 200,000 pregnant women in the United States have been vaccinated for COVID without any complication. Other families are worried about myocarditis, or inflammation about the muscles of the heart. As she mentioned, this is traditionally seen in older adolescent males more than anybody else. But what the data has shown is that COVID itself, the virus, actually causes much more severe cases of myocarditis than the vaccine does. In the cases where kids had myocarditis after the vaccine, the cases were short-lived and self-limited and were mild. Many families are worried about the unknown. They say they've had COVID, it was a mild case. They're comfortable with getting it again if that happens. but they're not comfortable with what the vaccine may do or may not do to them. They feel more comfortable chancing that they're going to get another COVID illness than trying a new vaccine. And finally, I would say the other thing that I'm hearing that patients are saying is that the vaccine was approved too quickly, that it was not appropriately vetted, it was not appropriately examined. Families suspect that corners were cut or steps were skipped, when in actuality, it required 3 phases of clinical testing, as all drugs do. Some of the differences with the COVID vaccine's approval is that many of the steps were done concurrently. Instead of one phase leading to another phase, leading to another phase, many of the phases were done at the same time. In fact, manufacturing was started on many of the vaccines before the trials were even complete, which also allowed for the process to be sped up. In addition, because of the widespread nature of the pandemic, so many families were concerned, there were lots of volunteers that were willing to participate in the vaccine trials, which made it easier for the companies to get participants. But the big picture is that no corners were cut. This vaccine is now going to be the most heavily studied vaccine in history. So knowing these concerns and these fears, what do I say to my families? How do I reassure them? How do I get them to understand how important this is? Well, I would say it's a process. For those families that are hesitant and questioning, I try to understand what their fears are. I try to understand what their questions are. I try to explain to them and remind them that we are in this together. I care about the health and well-being of their children, and I will always suggest the best possible course for them. I let them know that ultimately it is their decision to make, but that I am here as a resource and I want to be here for them. I acknowledge that it's normal to be afraid of new things, but I let them know that this vaccine was built on over 20 years of science. The science behind this vaccine is not new. It is normal to be afraid of the unknown and want to protect your child. And with that in mind, vaccination is the best protection around. I also try to remind families that the decision not to vaccinate is the decision to get the COVID virus. There's no predicting how severe that will be. You are taking a chance that it will be mild. However, 1 in 5 hospitalized children end up in the ICU. During the Omicron surge, children under age 4 were hospitalized 5 times more than during the Delta surge. In the United States, 12 million children have had COVID-19. 120,000 have been hospitalized, and close to 1,500 of them have died. In California, we've had over 900 cases of multi-system inflammatory syndrome. And as Sandy said at the beginning, COVID is now in the top 5 leading causes of death in children, and vaccines make these deaths preventable. COVID is not a benign illness. The vaccine prevents serious complications like long-term COVID, like I said, multi-system inflammatory syndrome, hospitalization, and death. As I mentioned earlier, the vaccines are safe and effective in children 6 months and up. They've been properly tested and vetted. The production didn't cut any corners. I remind them that getting our children vaccinated helps us all. It protects the high-risk elderly in the community. It protects the babies under 6 months of age that can't get vaccinated. It protects the immunocompromised and the high-risk pregnant women. Vaccinating our children improves the health of our community. Another point I like to drive home with families is that children and adolescents need their lives back. They need to be able to fully gather with their friends and peers. They need to go to dances and proms, to participate in sports and activities. They need to fully be in school activities and not home on Zoom away from their friends. Because of COVID, they've missed milestones and critical stages of development. This has led to an unprecedented mental health crisis, and we all need to do our part to bring that to an end. Finally, I remind families that vaccines are safe, effective, and free, regardless of insurance or immigration status. And hopefully, after going through all of that, they agree to move forward and get vaccinated. Thank you.
Thank you for that very powerful personal testimony from a pediatrician. 1 or 2 questions before we move to our third speaker, Dr. Miller. How long will immunity last, and does it vary depending on the age of the child vaccinated?
So I don't know that I have an answer for that. Maybe Dr. Abascal in public health has a better, hold on that. I mean, I imagine that just like us, there are going to be multiple vaccines for them. I imagine they're going to get boosted just like we get boosted. And I would say that most of us think that we are going to end up, getting a COVID vaccine like we get a flu shot, and are hoping that COVID and flu will someday be together so we can just get one shot. But I suspect that, it's going to be something like, at least the way it's looked is it's been something like 6 months, 5 or 6 months before we have to get it again. And so I suspect it will continue to be something like that.
And a question on my text. Do you personally recommend between Moderna and Pfizer for 6 month to 4-year-olds? Do you personally think one is preferable over the other, or does it come down to basically a parent making a decision? I mean, how does one make a decision? Is it really a question of which is available?
I think it really is a question of which is available. In our office, we have Moderna right now. That's what we have, and that's what we're giving. When I first started to read the data about it, I think my knee-jerk response is, well, I want Moderna because it's only 2 shots. I have to convince families to get 3 shots if they do Pfizer. And so that's what I felt at first. And then I thought, well, Pfizer numbers look better, although Pfizer numbers, when you look at the data of how many patients they each manufacturer studied, Moderna looked at more patients than Pfizer looked at. So I think in the end of the day, it comes out in the wash. And I think they're both pretty similar. And so I've told families, get the one they can, get the soonest one they can get to get their kids vaccinated so we can move forward. And I think that that's the right answer, is get whichever one you can that's available for you.
Thank you so much. We're now going to go to our third speaker, and I hope Dr. Abascal and Dr. Miller, you'll stay for us for our final Q&A. Dr. Sarah Takakawa is an OBGYN with Kaiser Permanente, and with her husband is raising 3 children below the age of 5, one of whom now has COVID. We are extremely grateful to you. We are sorry your husband can't join us as originally planned, but you will speak for both of you as parents. Thank you for joining us, Dr. Takakawa.
Oh, yes. Thank you so much for the invitation. I am happy to be here. And Voltaire, I will also say his piece. He is an internal medicine hospitalist with UC Davis. So since March of 2020 has been working on the front lines with adult medicine. I have been also working on the front lines on labor and delivery in the emergency rooms and the clinics with my obstetric and gynecologic patients. Meanwhile, we have been raising our children. At the time of the start of the pandemic, we had a almost 3-year-old and an 18-month-old. She was almost about 15 months. And we ran to get our vaccinations in December 2020, and in January of 2021, at which time we decided, since I was vaccinated, that we would attempt a 3rd pregnancy. And I had no fertility issues. I tried to tell my patients I had a very healthy pregnancy, even at close to 40, and had been fully vaccinated the month that I got pregnant. I was still pregnant when the booster became available in my 8th month, and I ran to get the booster. I thought I have been working on the front lines. I have seen firsthand what the COVID-19 infection can do to otherwise extremely healthy young women during their pregnancies. I ran to get my booster in my 8th month so that I could be vaccinated, so that I could have protection while I was going to be in the hospital, but also for my unborn child, who would now get some antibodies crossing through the placenta, as well as a boost for antibodies to be in my breast milk. While I was feeding him, I also gave some of the breast milk to my, at the time, under my 2 daughters under 5 years old, who the vaccine was not yet available to. Watching firsthand adults our age, otherwise healthy, succumb to the disease. Voltaire has had to speak at funerals for colleagues because of the pandemic. It seems easy to us to make this decision about wanting to get vaccinated and to encourage other parents to have their children vaccinated. But we also understand that it is a discussion that needs to be had with parents who might not seem as obvious, who want to have that discussion. My husband and I had a discussion about the facts that have kind of been presented. Which one do you prefer? Would you want Moderna? Would you want Pfizer? Why? And I believe a couple weeks after she turned 5 last month, my eldest daughter, I believe she got Pfizer because that was what was available to us that day. Because she got her vaccine, we said, you can get a special treat. And she got a donut that day for getting vaccinated. But because she was getting vaccinated and she got a special treat, the 3.5-year-old said, I want my vaccine. I want to go get COVID vaccinated. And it wasn't available to her last month. On Tuesday, when it became available, I logged on to my Kaiser app, and it had been updated to say that my 3.5-year-old and now my now 8-month-old are available. The vaccine is available. Would I like to book them an appointment? And so I did. I booked the 3.5-year-old. I said, look, you can get it now. You get your special treat. And she wants a lollipop. To go and get the vaccine with her older sister's number 2. So when the older sister gets her second one, then the 3.5-year-old could go. And their appointments were going to be for tomorrow. But because we are also at daycare, my 3.5-year-old came home yesterday with symptoms of vomiting and a low-grade fever. So I tested her at home and it immediately came back positive, the antigen testing. I have tested everybody else in the house, and we are all okay right now. But it is it's just disrupting. I don't even know if disrupting is the word, or debilitating, as Dr. Abascal and Dr. Miller have talked about. It interrupts not only our family and our family having to watch a sick toddler. Taking care of toddlers is hard enough on its own, let alone taking care of a sick toddler. And now we have taken all of the kids out of day. We're off, for a couple of days, but if we had to cancel schedules due to childcare, if we had to cancel patients that we're supposed to be taking care of and jobs, if there are more children getting infected in the daycare and their families, et cetera, it just, it just goes to show that if we can vaccinate, like my 5-year-old, she's not having symptoms. She's not having any fevers. Is it because she has been vaccinated? Is it cutting out?
Yes, we're just having a few problems with choppy. But please go ahead. I think it's not as bad as it could be. Let's stay on it because
It'll catch up.
Yeah. So you're
So we're excited. We're excited to get the vaccine. I am also excited. Congratulations, Dr. Abascal. And maybe now the 3.5-year-old will be one of those super protectors because she has had the virus. And I have rebooked her appointment for after her quarantine. And we will be taking all 3 kids at that point once we're out of the quarantine. We think that the fear of the unknown or any potential side effects outweigh what we have seen firsthand with hospitalization, long COVID, the multi-system inflammatory syndrome, and the impact of COVID, not just on one person, not just on one family, but it's the legs, the arms into the community that can affect. We're trying to teach our children, not only are they getting the vaccination to protect themselves, but also to protect their classmates and the greater community.
Were you concerned or are you concerned about children in preschool, in daycare, congregate settings where there is no mandate that everyone be vaccinated? And how as a parent and also as a doctor, what is your advice or what is your recommendation about that? Is it simply to focus on getting as many people vaccinated voluntarily, or do you think that mandates for this very highly transmissible variant would be preferable for young children?
That might be tricky, and I might be answering it from one place as both a parent of young kids as well as a physician. But we have chosen to send our daughter to kindergarten in the fall at a school that mandates vaccination so that she can focus solely on her education and not worry about who is masking, who is unmasking, when do they feel safe, when do they not feel safe. We try to tell them also as children as much as possible to practice good hand washing and to wear their masks as possible. But we also know that with children, with toddlers, that is more difficult. We feel like because we trust our children, but we know that we can't trust them to wear their masks 100% of the time and have the best hand hygiene, that the vaccine will be that added boost of protection, maybe the ultimate protection for their safety going back into preschool, now sports activities, birthday parties. We would love to be able to participate in these kind of normal activities that the 3.5-year-old hasn't experienced yet because she has lived in the last 2 years in a pandemic.
Right. Thank you so much, Dr. Takakawa. And please thank your husband for taking the good care of your middle child. It's a joint enterprise. And I know one thing he talked about was the importance of all your children wearing masks. Just one final question before we go to opening up the conference to all our speakers. How hard has it been to get your children to consistently wear the mask? And your very important theme of wearing the mask to protect others as well as themselves. Tell us your, as one parent to many parents, how do you get them to do that?
I think because for the last 2 years, that's all they've known how to do in the daycare setting, that they're very good at it, especially the 3.5-year-old who kind of entered childcare as the pandemic was starting. She's only ever seen everybody's eyes. The 5-year-old, now that she is vaccinated, is having to be reminded that she needs to wear her mask because not everybody might have had their COVID vaccination yet. We get them the as breathable, as comfortable. I let them choose their styles. I offer it as an accessory to their outfits. Because they are girls, they like to choose. If it was a superhero theme, then they want that one, and they feel like they are doing their part and get to pick, taking ownership of what they're wearing, why it's going on their face, and also knowing that it's for the greater good as well.
I think you also offered us a great incentive for shots, and that is the donut. So I'm going to just remind myself, often when we do events, I insist on providing donuts. And I think it's just because I'm old-fashioned, but I love the fact that your child really embraced the idea of the donut. So now let's take up a few questions for all our speakers in the chat and from myself as well. Aaliyah Lee asks, and this again goes to the choice between Moderna and Pfizer. My child is 18 months old. Is there a preference depending on age for 3 doses versus 2 doses, or does it come down to whatever is available? Dr. Abascal.
I think the answer is what Dr. Miller said. I think what is available will be the best. Just to add something on the Moderna vaccine, we also expect that to have a booster, just as we've had with other vaccines. So eventually that will also be 3 doses, even if it takes a little bit longer. That's what it looks like. So I think it really depends on what's available and what kind of like, do you want, if you have both options, like, do you prefer to wait but get maybe lower immediate side effects, even though we don't expect anything severe from any, or just get Moderna? I think I have Moderna available at my pediatrician's office as well, and I think I'm going to do that with my daughter, just to get her vaccinated. But I mean, both vaccines, and we have data on other age groups for the Pfizer vaccines, and we know that it works and that it's safe. So I think we have enough data to like confidently say it's okay. Like you can't go wrong. And I think that's the message we also say to adults, right? Like both Moderna and Pfizer are equal. So you can't go wrong.
Great. Okay. Two of our speakers have experienced pregnancy or are pregnant now, but made the choice to be pregnant during the pandemic, and also knowing you would be in proximity with patients who may have had a higher risk. Can you talk just briefly about, and I know Dr. Takakawa, you talked about this too, but could each of you speak about that decision of becoming pregnant with the vaccine as your, in a way, your security, your buffer, and now seeing the importance of the vaccine as a buffer for your infant? It's a very important question we have from Henrietta Burroughs, how you deal with that tricky equation.
Well, we know that in pregnancy, women who were vaccinated had significantly less disease that would wind them up in the hospital and in the ICU. I saw multiple women, again, my age, struggling to take a breath, struggling in labor. When their body was in labor, they didn't have any energy to push. They didn't have any energy to hold their child after delivery because the virus had completely wiped them out. As much as I am wearing my PPE, I didn't want to take that chance. And I knew that I would not feel good. There was a chance that I would experience side effects following the vaccine. So when I got my booster, I got it on a Friday when I didn't have to take care of patients just in case I didn't feel well. But the symptoms and the side effects are so short-lived compared to the virus and having fevers and body aches for days, not being able to breathe. And again, so many of the long-term sequelae that we've been seeing from COVID patients, from people who have had COVID in the past. I am also following the American College of Obstetrics and Gynecologists, as well as, CDC guidance and information about the safety of the vaccine in pregnant women and breastfeeding women. Very safe. And I encourage as many of my patients and tell them my story, that I think that this will help prevent them from getting severe disease and again, passing it to their families.
Thank you. We're now going to our three speakers to ask them to have the last word at this very valuable briefing. And very simply, I think the story you tell of seeing a woman giving birth who's too exhausted because of having COVID is such a powerful image. All of us are storytellers. Most of us serve communities that disproportionately were impacted by the pandemic. Gradually, the vaccination rates for Black, Latino, and Asian and Native peoples of color have risen at a par, and even in some areas, more higher rates of vaccination than their white Caucasian counterparts. But will this be true for children? And I guess, what is your message for communities of color, parents of color, and their children who have managed to get through all of the access issues that have been so difficult to equalize on vaccination rates? What is now the message you have for parents of very little children to make sure that they are able to understand the importance of vaccinations for their children? I'd like to start with you, Dr. Miller. Is there a message, given the racial disparities we've seen so clearly during the pandemic, that would be especially relevant to communities of color we serve through our media?
There's so many messages. I guess the thing that I was thinking while I was listening to you speak is to tell our communities to talk to your doctor, talk to your pediatricians. We all have relationships with our families, and our families trust us to deliver care to their children. So I would say, if you're afraid, if you have questions, if you have concerns, reach out to your child's pediatrician, talk to your child's pediatricians, and get your questions answered from the people who know, not listening to what's on social media, not listening to what politicians are saying, not listening to what is on the news. Talk to people that you know and you trust, talk to your doctors and get the answers, and bring your children and get them vaccinated.
Thank you. Dr. Abascal, what is the last message you would like to leave with our media?
Yes, I think this is a message I usually give to my Spanish-speaking public I speak with, but I think it applies to all like racial and ethnic minorities, is that we know COVID has disproportionately affected these groups. We know that, but we now have a chance to turn the table and really have a tool that can help us reverse that. So it's on us as CDPH, as a public health agency, but also as parents, to take that decision. We always want to make the right decision for our children. As a mother, as a doctor, as a researcher, I know that. I know how hard it is, but we also have the tools to inform ourselves with our doctors, looking at information, asking questions. And if you want to make a decision, just make sure it's the right decision, because we have vaccines that work. And I mean, that's what I usually tell them. Like, we have the tools to not be as affected as we've been.
Thank you. And Dr. Takakawa, your last thoughts, especially about bridging the racial disparities that the vaccine, the COVID-19 has spotlighted.
And of course, my husband is Filipino and I am half Japanese. So our children are 3/4 Asian. And we see these populations, especially in Sacramento and South Sacramento. A lot of our patients are Asian. I think it kind of goes back to what Drs. Abascal and Dr. Miller were saying. There's a fear of the unknown. So ask the questions. If you're afraid, you have doctors, you have educators who can be culturally informed as well to help you make the decision on whether or not to vaccinate your children. And we believe, and we're trying to encourage the message of, it's not just to protect your family, but it is to protect your community, whether it's a Latino community, a Black community, an Asian community. It is to protect your community and your people. And so I think there's the fear of the unknown, and how can we help the parents to get over to the protecting what we would all do for our children. We would do anything to protect our children. And here is the evidence against a disease, a virus that is very real and very present and very much affecting our communities right now. So please let us know, talk to us, talk to your doctor, and we'll hopefully get you over that hurdle.
I can only say that an hour of time with the three speakers we've had today representing the medical profession really inspires me to do what I very rarely do, which is consider asking my doctor, going to a doctor. You are all three of you so generous with your own experience and with sharing your expertise. On behalf of all of our media on today's call, my heartfelt thanks for your time, and my thanks to the California Department of Public Health, Vaccinate All 58, for supporting us in today's briefing. Thank you all. This conference is now adjourned.